LYMA trial is a phase 3 trial conducted in both France and Belgium. The question that we address is the role of the maintenance with Rituximab after autologous stem cell transplantation in mantle cell lymphoma patients, the front line. The main objective of the LYMA trial was to investigate the EFS, and our hypothesis was quite good because we were able to demonstrate that there were strong benefits to add Rituximab after autologous stem cell transplantation. Just to give you the numbers, at 4 years, the EFS for the patient enrolled in the Rituximab arm is 79% versus 61% in the observation arm, and the p-value is highly significant, 0.0012. And if we look at the PFS, which makes also a lot of sense from a clinical point of view, in terms of PFS, we also observe strong benefits to add Rituximab because at 4 years, the PFS is 81% in the experimental arm, so with the maintenance, versus 64% in the observation arm. So these are already a very good signal in favor of Rituximab maintenance after autologous stem cell transplantation. But what we also observe, and what's not really expected, is that there is a strong benefits in terms of overall survival too. 88% at 4 years versus 81 with a p-value of 0.04. So this is a very important message that we were able to show with the LYMA trial.
I understand this makes your recommendation of a new standard of care.
Well, definition of new standard of care is always something people want to do, but I think honestly we have defined a new standard of care among others because it's not only a question of Rituximab maintenance. So as I said, we demonstrated that one infusion of Rituximab every 2 months for 3 years provide better EFS, PFS and OS. But it's interesting to have a look at what we did before the randomization. We treated patients with 4 courses of DAP because it has been shown that high-dose Ara-C is a key drug in the treatment of mantle cell lymphoma. So we didn't use R-CHOP, which is the gold in non-Hodgkin lymphoma, but only RDAP, 4 courses. And we have exactly the same complete remission rate after 4 courses of DAP versus CHOP or DAP or what have been published. And the other things is the conditioning regimen. If you look in the literature, most of the time, the conditioning regimen is TBI based. Here in our trial, like the Nordic did, we didn't use TBI, but R-beam, so fully chemotherapy conditioning regimen. And once again, we were able to show that the complete remission after autologous stem cell transplantation without TBI is also very high and fully comparable to what we have observed in previous trial. So yes, I think we defined a new standard of care, RDAP, R-beam, followed by the Rituximab maintenance for 3 years.